Hello, everybody. My name is Casey O'Brien. I am currently a senior at University at Albany, SUNY, and this project is in part for my artificial intelligence background. I'm a member of Women in AI, and it is also for my final project at University at Albany, SUNY. So my final project is on artificial intelligence for mental health care treatment. So talk about anxiety, right? Talking about artificial intelligence and mental health care treatment. How do the two go together? What is artificial intelligence and how do we work with it? So artificial intelligence, I think you should do your own research on, because that is a separate conversation in and of itself. But essentially, artificial intelligence is something that can help us, and Americans are ready to buy in. More Americans are on board with artificial intelligence than those who oppose it, which is great. Um, but we have to think about those who are opposing it and why they're opposing it, and we have to develop trust amongst them. Um, and we have to know when to stop. Um, Artificial intelligence is capable of replacing a lot of jobs. Again, this is a separate conversation that you should have with somebody once you have done some research, but I highly advise you do some research. All that I would like for you to take from this slide is do not get anxiety about artificial intelligence in the healthcare industry because it will help. All right. So there are accelerators and barriers to artificial intelligence adoption. You can see these in the infographic here. Awareness, curriculums, these are all accelerators. There's increased awareness about artificial intelligence and what it can do. There's college curriculum. This is being taught to your children. This is being taught to you. This is being taught to your peers. It will be to your children. It's an emerging field that will help us, again, a lot. It's a matter of how we use it and the value that we put into it. There's been a lot of United States government investment into artificial intelligence. It's fueling the world around us. Um, and this brings us into our next slide, which focuses more on mental health and why artificial intelligence may be useful in mental health care treatment. So investment goals, right? I mentioned that we invested a lot into artificial intelligence. So investment goals. I'd like to speak about that first. We want a good return on investment. We want people to be helped via all the taxpayer money that has gone into artificial intelligence and research and artificial intelligence in the healthcare industry. We want all of the hard work of the coders and the programmers and the data scientists and researchers. We want the return of investment there. So how are we going to get it in the mental health care sphere? So according to Smith, and my everything is quoted at the end and cited at the end of this slideshow. According to Smith, up to 50% of patients are not reaping the benefits of medications they are currently prescribed. Artificial intelligence can help with this. There are many off-label uses for pharmaceutical drugs that we do not yet know about. Artificial intelligence can help with this. So that our off-label uses means there are uses of certain medications that we don't know about. So drugs that we already use, such as a drug that's used for PCOS, also helps with type 2 diabetes, was one example that I found in my research. There are many others. Again, you can do your own research. In 2019, approximately 20% of Americans had received mental health treatment, a number that is expected to continue to grow. So we have seen many more people getting on board with mental health care treatment because mental health is just as much of an issue as physical health is. And if you don't know that yet, you should know it, because addiction is a huge problem in this country. We're going through a huge opioid epidemic. It all ties back to mental health. Also, and then if addiction isn't involved, people have mental health problems, depression, anxiety, bipolar disorder, the list goes on and on. And artificial intelligence may be able to help this. So more about mental health. Poor mental health can affect an individual, their friends and family, as well as colleagues, bosses, professors, etc. Thus, seeking a more proper method of treating mental health issues is a demand we currently have in the United States. And then to tie it all together, artificial intelligence can examine a multitude of factors and hopefully aim to alleviate up to 50% of mental health related issues, if not prevent and cure them. So these are statistics that we cannot argue with. Artificial intelligence can help in this world. All right. So even though I could go on forever and ever talking about this, I want to thank you for listening and watching. I am currently working on a 10-page paper about this topic. If you'd like to read it, you can email me at casey.rose.o'brien@gmail.com. I'd love to send you a copy of it when it's all done. And then my citations. Thank you so much. Have a great day.